All right, now we are excited to take a minute to talk to Ben Stewart. Ben is the director for state and local government for SAS. SAS, as I have learned recently, is the largest private data company in the world. They are working with local governments, hospitals, Fortune 500 companies around America, around the world, and recently have been pioneering behind the scenes. You guys on this webinar are going to be the first to know about what I think is going to be a groundbreaking software that can answer this question, and that is how data can help communities solve the opioid overdose crisis. Ben, here's this great biopic of you. I like the long hair, man. Was this during COVID?
This is a family picture, man. I think at some point I need to get an actual headshot, but today's not that day.
Well, we're so happy to have you on either way and to discuss again for the first time the mayors, the county leaders, sheriffs, and others on this webinar are the first to hear about a new product that SAS has produced in partnership with Project Opioid, kind of picking up on some of the amazing work SAS has done previously on the opioid crisis. So, Ben, we're so excited to have you on and to hear more about this.
Well, it's such a pleasure being here, and it means a lot to have the invitation to speak to you again and your people. Thank you. So next slide, please. So at a very high level, a little bit about what SAS does in government, and then specifically around opioids. So as Andre was saying, we are partners with many national governments here in the United States, almost every federal agency, national security. What's near and dear to my heart, it's state and local government. And with state and local government, we've been partnering on some of the most complex issues that have been facing us for more than 20 years now. Specific to opioids, though, which is why we're all here today. We've been doing a variety of things, creating dashboards, predictive models to better understand what are the large contributing factors of problems in our communities. And what you're looking at now is just one of many examples that we've built. So obviously that's the state of New Jersey. New Jersey came to us because they were wanting to take healthcare data and criminal justice data, put it together, and get more value out of it. So a couple examples of what we did for New Jersey was that we started doing naloxone hotspotting so that they knew where the majority of their need was, so they could connect that to their communities more successfully. And also from a law enforcement perspective, they wanted to see some of the criminal rings that were bringing these legal substances into their state so they could better get in front of those issues. Next
so,
slide.
Ben, you've done some great work on the opioid crisis, but when I met your team a few months ago in your Florida office, I met with Mark and Heather and the Markman Impact folks. I think the conversation was pretty somber because despite some of the best efforts of SAS and really thousands of advocates, tens of thousands of advocates around America, we see the overdose crisis getting worse. We've heard the numbers again today on the webinar, over 100,000 deaths. I mean, this has to be heartbreaking for you and your team at SAS as well.
It's exactly what we've been talking about today. That line is not where it needs to be. And a lot of people are doing what they can in the private sector, NGOs, local governments. And what we're looking at is, that's the scoreboard, to tell you the truth. And so when we saw this, we knew that we had to do something different and we had to take a different approach if we were going to impact our communities and be the sorts of partner that we hold ourselves out to be, Andre.
Well, and that's where you guys got to work. And again, I'm so excited and I'm privileged that I have had the opportunity to work with you over the last season of time on this new product that I think is going to revolutionize how communities impact the opioid crisis. But it really started not with solutions, but with problems that you guys were trying to solve.
Absolutely. And we're a data company. So please, everything that I'm going to be talking about comes from that data lens, Andre. But there's a variety of things that we've seen during our over 10 years on different parts of this problem. The first is that treatment can be sporadic, and the way that information comes back to us around, was the treatment successful, who got it, and what's the next step? Sometimes it's tracked poorly, or tracked not at all. Second thing is it's difficult to find help. People in our community may not know what the right next step is for them, or even where to go to find it. The third is that there's really not a cost basis. How much does a successful treatment cost? Where do I go to find it? Who are my providers that are doing the best work in my community? The fourth is that everyone really has their own journey. This is a very individualized problem. And today, companies like ours have been looking at it from, at best, a community perspective, if not a state or a national perspective. And the last thing is we just don't have time, Andre. As the substances are getting stronger, as one bad experience could lead to death, we need to shorten the time that we can put the right answer in the right people's hands.
And so as we were talking about what's missing, again, from a data standpoint, that community leaders have to have to impact this crisis, what is the basis of this new product people are going to hear about? What did you guys find?
So the new product is called Moment. And the reason why is that speed matters. We need to be sure that in the moment of crisis, that there's a step that can be taken so that the community resources can be committed and brought to bear in a way that's going to save a life. And what you taught us, Andre, and the more that we spoke, was how do we do a couple things well? One, how do we have a community-specific resource connection? How do we know the providers, the capacity, simple things like distance, right? Does that provider have the ability to go and have a mobile unit deployed? The second part about this always comes back to the person in crisis. We need to have a real-time way to meet that person, to understand their specific individual characteristics, and then provide them the best recommendation possible about where to go to get help. And that's it. Go ahead, please.
Ultimately, it leads to a connection to the treatment necessary. And again, one more slide where you guys talked about what needs to be different, in communities. And this is just a little bit of a peeling back of what Mark and his team have been working on. Talk about what needs to be different from a data standpoint.
Absolutely. So we need people on the ground in the community that are collecting this data from individuals, right? And that requires a different model than what we're used to. We're deploying people with these capabilities, with the knowledge of the community, into where the points of crisis are. And this is real-time data for each patient. I mean, we're running artificial intelligence and machine learning models behind the scenes once this information is collected, so that we know, based on that individual's characteristics, how are we going to make the best recommendation for treatment for that individual. And you'll see that we're really looking at who are our providers, what are their capacity, what are their core capabilities, and are those a good match for the individual that's in crisis in our community. And this gets the best patients or best possible outcome to the patient almost immediately. And also from a more macro perspective, as we're thinking about, over 18 years when some of these dollars can be coming to our communities, we need to continuously improve. So what are the profiles of people in our community? Who are the providers that are doing the best job with them? And how can we make sure that as we learn more, that we're continuing to be more and more successful in saving lives?
And Ben, as your kind of co-pilot on this, I'll give the folks, who are watching the webinar right now, a little bit of a visual perspective of what this regional overdose prevention software that we're calling Moment can do. And Ben, first of all, as someone who's been on the ground floor in hundreds of communities across America, I think what most people who are on this webinar are thinking right now is, we've never seen anything like this before, because ultimately in every community, there's all kinds of resources available. There's all kinds of folks working on the crisis, all different parts of the community who care, but ultimately they're all disconnected and people struggle to find help and the community struggles to organize itself around help. And as you said earlier, speed matters. Let's say you have Sally, and Sally is struggling with drugs, and she's now struggling with drugs in a world where fentanyl can kill her with one pill. What we found, Ben, in our research is that Sally doesn't struggle alone. Sally's got her family, her friends, others in her support system who also want to help her. 60% of the outreaches to a call center or to a rehabilitation hotline from a family, a friend, not from just the person struggling. And so how do we take Sally, all her friends and family, and coordinate them on a path to get help? This was the problem. How do we navigate all of that together? Data, software, machine learning, AI, what you guys at SAS do better than anyone else. That ultimately was the answer. And that's where we created Moment, the SAS regional overdose prevention software that connects with an app on everyone's phone who wants to be a part of this solution at a community level. It takes all of the resources that a mayor, a county leader, a sheriff has at their disposal potentially. It aligns them in your software, and then it connects a person in need in real time with the solutions that are available. We're not going to go into all the details because some of it, Ben, I know we want to wait and hold off to share later in some of our information sessions. But Ben, how exciting is it to think that the technology that you guys use on transportation, tourism, economic development, you use this technology with some of the largest companies in America who are selling hamburgers and televisions and everything else that you guys specialize in. How exciting is it to see that technology now deployed at a community level to save lives?
It's why we're here. Andre, as you know, I came from state government. There's over 100 people on our team, and almost all of us came from some form of government. And so hamburgers are great. Everyone loves them. But what we want to do is be a part of saving lives. And if through your leadership and the way that you've described how to really access the information that we need to deploy those great things that we do, that final mile is something that we didn't have the perspective before we spoke to you and your team. So for us, it's a passion. It's more than a passion. It gives us purpose in why we build all this technology. And it's going to allow us to do good in a way that we couldn't before.
So for communities who are interested, there's kind of two things we want you to hear. By the way, if you're on this webinar, Ben, these are the first community leaders in America to hear about this software that I believe over the next year, 2 years, is going to revolutionize our ability to save lives. We lost another 100,000 young Americans, vulnerable Americans in 2022. This software, I'm telling you, is going to be the breakthrough that communities need. So Ben, if someone's interested, what do you recommend?
Absolutely. So as you heard, we've done a variety of things, but this final mile that we talked about today, we're going to pick a handful of communities and we're going to do the initial pilot launch of this, and we're going to be doing it this summer. So Andre, we're actually interviewing communities now. And what our goal is to do is to find some really good peer examples so that when we roll this out nationally in 24 and 25, there's going to be that peer-to-peer relationship. This is how this was deployed in our community. This is what we saw as successful. Because we know that it's great for us to to have numbers and all the things that we typically use, but the ability for peer communities to talk about how they lived through this and how this potentially revolutionized the problem in their backyard, that's really where we want to be sure those are the messengers.
Got it. Ben Stewart, Director for State and Local Government, SAS, thank you so much. And again, I just want to reiterate, I know you guys are in the business of creating software that changes the world, but this is a solution that ultimately, Ben, you and your team have put your hands on that can save lives. So just a big thank you again, Ben. All your information is going to be in the chat right now. There's also a link being dropped in the chat right now for people who want to sign up for that 30-minute June information session that SAS is going to be putting on. If you're a mayor, a county leader, a sheriff, a hospital system, get more information on this software. It's going to empower your community to navigate those in need to life-changing resources. Ben, thank you again so much.
Thank you so much for having me. It's been a pleasure, Andre.